Hello, I'm Diane Taylor. You've got to really use your imaginations now. This is Tyler. Tyler is up to his knees in snow in Shropshire. Please bear with me. Okay, I became a service user of South Staffordshire and Shropshire NHS Foundation Trust through their mental health adult acute services about 17 years ago, following the birth of my son, which had been quite traumatic. I was admitted as acutely unwell into the local psychiatric hospital and became a service user. I still use services now as and when I need to, and that's fine. I've had another admission since, also onto adult acute. Whilst as an adult acute patient, I discovered that I could do involvement and I could shape the services of the trust. I could make an impact on the way I was looked after and the way other people were looked after. So as I became more and more well, I became more and more involved. So the trust as a whole were largely getting it right. They were involving service users and carers at every level. So I got to do everything from reviewing the latest leaflets that were going to be published to being on the interview panel for the new trust chairman and everything in between, inspecting wards, presenting at conferences, things like this, and just generally talking about what it feels like to be a service user with a mental illness. So I was asked, would I address the CQC? Ooh. So the introduction, you've probably all been there now. You know, the chairman stands up and does his bit. The chief exec stands up and does his bit. Or her. Just happens to be men in our trust, yeah. And then I stood up as a service user. And I said to the chief exec, I will speak to the CQC on two conditions. The first one, I tell them what I really think of your services. And the second one, you buy me a cup of coffee. He still brought me the cup of coffee, so we can't have gone too badly wrong. But over that cup of coffee, he said to me, what can we do better? We're doing this involvement, things are looking rosy, things are looking good, people are really positive about the involvement that we do, but how can we do it better? To which I, not being backwards in coming forwards, informed him that he needed to employ someone to train service users and carers to do involvement. So instead of turning around to a service user or a carer who's volunteered and saying, I want you to sit on this interview panel, teach them how to interview somebody, teach them how to do the paperwork, teach them how to have that voice, and then ask them to do the interview panel. Makes sense. You wouldn't expect a member of staff to just rock up and do something. You train them. Why expect a service user or a carer to? I also said that that person needed to have genuine lived experience and to give a voice to the voiceless. There are many, many people within our services, learning disabilities, mental health services, forensics, those are particular areas that don't have a voice, be that because they are unwell, be that because they don't have the language abilities to communicate, or be that because of restrictions placed on them by the Mental Health Act. So it was somebody to break down that barrier between the staff and the service user. Somebody who was not seen as, well, if I complain or if I comment about the services, this could affect my care. That is a real, genuine concern amongst service users, particularly if you're already slightly paranoid. Think that one through. So, much to my amazement, 3 months later, I was invited to apply for the job that had been created on the back of what I'd said. I was even more amazed when I got it. So 18 months ago, I started my new job. I've never had a job before where I'd written the job description. It was quite bizarre, I have to say. But the priority for me was to develop the training. So the first training programme we put together was an introduction to involvement. We've now trained over 50 people in less than 12 months in introduction to involvement. So people come along for a half a day, service users, carers, staff, partner organisations, the more the merrier, come along and find out what involvement means and how they can do it and what they can do. And that's what we do. We then did a bolt-on module for place. So service users and carers doing the patient-led assessment of the care environment knew what to do. If you've ever seen the paperwork, you'll know why they need training. We do recruitment and recruitment and interviewing. We also do about meeting etiquette. So we invite people to go to the trust board to tell their story. We teach them about meeting etiquette before they go. If you've never been in that professional line, you don't know. Let's teach people. There are many more modules to follow. I just can't write them fast enough. So, how are we doing now? Service users and carers, feedback, great. They think we're doing brilliantly. They really like the training. They're feeling more empowered. Superb. The staff, loving it. They ask for someone to come along and do involvement. The person rocks up. They know what's expected of them. They know what they're doing. They're confident they can lead forward. Superb. Oh dear. Forensics. Poor forensics were not being heard and they were not being included. This was a real problem. So, how were we going to give a voice to people using forensic services? We went onto each of our forensic wards, medium and low secure, and identified a service user representative for each ward. And this is Tyler. And Tyler is our representative for one of the low secure wards at the Redwoods. So they work with within the restrictions of them status within the Mental Health Act. Now, some of them are not allowed leave. Some of them are only allowed certain amounts of leave, only on certain premises, only at certain times. Sometimes we have to apply to the Home Office for permission to do things. But we work around that. And if all else fails, if you can't move the Mohammed, you move the mountain. So we now go into the forensics units and train these people so they can still do involvement and they can still be involved in their things. Meet Tyler. Okay. Tyler has presented his story to the board. He's presented at community engagement meetings. He's reviewed leaflets in literature. He's represented his ward in bi-weekly meetings. He presents feedback at service user and service user and carers involvement celebration. I knew I wasn't going to get that right. He delivers training with me. We co-produce several of the courses now within the forensic unit. So I'm not a forensic service user. I don't know what it feels like to be on forensics. He does. We use his lived experience. And he's about to become our lead for the place for the forensics units. So our forensic service users will carry out their own place inspections on their own wards. They live it every single day. They know what it's really like to be there. So, how can you roll this out in your trust? Well, we're the experts. We live it. We live day in, day out with whatever our condition might be that a physical condition, be that a mental health condition, be that a learning disability, whatever that condition may be, we live it day in, day out. If you want to improve your services, give us the tools that we need to give us that biggest impact possible. Talk to us, involve us at every level, empower us. Give us that time, that energy, give us those opportunities so we can really, really shape your service. Trust us. There's a bit of a standing joke in our office that I'm the lunatic that took over the asylum. Well, yeah, it probably is true, actually. But yeah, you know, trust us, we have got a pretty good idea of what's going on. Yeah, my background is in education. I never thought I would teach again. I never thought I would work again. I didn't work for nearly 6 years. And now I'm back doing what I love. I'm just doing it in a different place, in a different way. Work with us. Yeah? We're all after the same thing. I can't remember who said it earlier, but someone said, if the patient experience is good, the staff experience is good. It cuts both ways. If the staff are happy at work, the patients will be happy. The patients are happy, the staff will be happy. We're all after the same thing. Let's work together to get it.